The number of people killed worldwide in the coronavirus pandemic has now passed 250,000. And fresh data shows that the UK has now become Europe's latest epicenter. Figures released by the UK's Office for National Statistics show the number of deaths there has moved past 32,000, overtaking Italy. The country has been under lockdown since the end of March. Strict social distancing measures remain in place, and authorities are urging people to save lives by staying at home. The UK now has the second highest coronavirus death toll in the world, behind the US. Joining me now from London is our correspondent Birgit Maas. Birgit, the UK has become the new epicenter in Europe. How has it got to this point?
Well, the figures include all the suspected deaths of COVID-19. This is what the government is saying. So not everywhere where a test has confirmed that a person has died of the virus, but also where it was suspected. And of course, the government are saying that you have to take it with a pinch of salt, that every country records the deaths in a different way, and that only in a few months, maybe even years' time, will it be possible to have an accurate comparison. But I think one thing is clear: the UK is definitely hard hit by the virus. And the head of the statistics organisation in the UK told British media that the death toll could be even higher. That could be over 40,000. That's what they are suspecting. And of course, behind every statistics, there are people, and there is a lot of heartbreak here in the UK with these numbers coming out. Also within the medical community, doctors and nurses, they are pressing for better protection. A lot of medical staff have died, and yes, there is a lot of anguish about these figures.
Boris Johnson's government has come under fire for being a bit slow to react to the crisis. Does the government now seem to have a grip on it?
Well, yes, this is what the government are saying. They are ramping up their testing, their tracking and their tracing. This is, of course, a strategy that they had deployed very early in the crisis. And I think this is the consensus that critics of the government are rallying around, that in the early stages not enough has been done. The UK was lagging behind other European countries when it comes to the spread of the virus, and very early on the government could have done more if there was a capacity to do more testing. And the chief scientific advisor has admitted that the government could have done more in the early stages. And of course, because the testing was quickly abandoned in the early stages when there could have been more of a muting of the spread of the virus. This is when actually the virus then spread, and now it's very difficult because it is so widespread in the country. And now to catch up and now to develop these new techniques to test and trace, and the government has developed an app. Now it's very late in the day to do that, so a lot should have be done much earlier.
Birgit Maas in London, thank you. And here's a roundup of some of the other pandemic news of today. The German state of Bavaria plans to partially reopen for tourism this month. Its state premier said hotels and restaurants could operate under strict social distancing requirements. The virus has now officially arrived in war-torn Yemen, with the Houthi-controlled government reporting the first confirmed case in the capital Sana'a. And in the US, New York State has reported more than 1,700 previously undisclosed deaths at nursing homes and adult care facilities. The sight of armed men protesting against a pandemic lockdown in the US state of Michigan last week has reignited the debate about gun control. In Michigan and in other states where similar protests have taken place, it is legal to openly carry a firearm, even in government buildings. But while some Americans are using the opportunity to argue for modifications to their constitutional right to bear arms, others are turning to guns in a time of fear.
Magazine loaded, release and fire. Mason Phan has been shooting firearms since he was a child. But since the COVID-19 pandemic, the son of Vietnamese immigrants has been beefing up his skills. He says there's a general feeling of insecurity among Americans.
With the uncertainty of what's going on, the pandemic, there could be anything that could happen, such as riots, such as people going crazy, you know. There's also always racism in there involved. So having a gun will help protect myself and also my family.
Shooting ranges and gun shops in the state of Virginia are considered essential business and were allowed to remain open during the shutdown. The Clark Brothers range has twice as many customers as usual. Owner Sean Clark says gun sales at the decades-old family business have never been so high.
There's just some people that said, I'm not sure how to deal with this. If I have a firearm, I can deal with this. If somebody tries to take something of mine, I can defend myself.
Hardly anyone here wears a face mask. Social distancing doesn't seem to be important. But some have come to reflect on what drives Americans to guns these days.
My explanation is we Americans in the country have gone berserk. We think this coronavirus is the next apocalypse. And it's just, and people are scared for some unknown reason. And I think that's as simple as that.
What's fear for some is business for others. There's a 1-hour wait time and extra paperwork to get into this gun shop in the city of Arlington. The store was completely sold out in the early stages of the shutdown. Shop owner Sean Poulin says he is still struggling to keep up with the client's appetite for firearms.
We can't meet the demand of all the customers. We don't have the variety that we used to have also access to. Variety meaning of pistols, shotguns, rifles, including ammunition. Ammunition's also being treated just as similar as toilet paper. People are buying excess and without any real utilization of it.
Mason Phan has not bought any new weapons since the virus hit. For him, training at the shooting range is a great excuse to leave the house while he's working from home. In America, now more than ever, guns are an essential business.
India has reported its biggest daily jump so far in confirmed coronavirus cases, a rise of almost 4,000 to more than 46,000. Health officials said the spike was due to increased testing. Regional governments have started to ease the 6-week lockdown, and that includes allowing alcohol shops to reopen. But the central government has imposed a special tax of 70% on liquor purchases to prevent large gatherings at shops.
Going for a liquor run. People in Indian cities couldn't wait when they heard that certain shops were reopening. Police had to implement social distancing.
Alcohol shops have been shut for 40 days. People are very anxious. Of course, we've incurred a lot of losses because alcohol is not considered essential goods. But after more than 40 days without alcohol, it's become more essential.
The country's lockdown has caused economic misery for millions of workers in the informal sector. For many of them, a reopening can't come too soon. But easing the restrictions makes some people nervous.
I still feel they need to be very cautious about how they are handling the whole thing and implementing the lockdown, the relaxation. Because there are a lot of people who are taking, they are getting very happy about the entire thing and they are going full speed ahead, not realizing that not only can they be carriers, but they can put other people at risk.
There's also the risk that the official count is lower than the actual rate of infection. New mobile testing laboratories are supposed to get a better picture of the true number of infected people. Officials say Indians should not expect everything to return to how things were before.
We're now transitioning into a new normal. It's important we remain careful, conscious and vigilant to continue our battle against COVID-19 with the same speed and momentum.
But on the streets, it's clear that there's a hunger or a thirst for relief.